Behavioral disturbances often arise in individuals with dementia, and in most cases, these behaviors are benign. However, in some cases, behavioral disturbances can escalate to the point where the person with dementia is placing themselves and others in danger. I've invited Edith Gentron from the Alzheimer's and Dementia Resource Center to help us understand what to do when this occurs. Welcome, Edith. Thank you so much for being here. So what are some of the behaviors by individuals with dementia that could be seen as dangerous to themselves or to others?
When we talk about an elder who has dementia that does something that's a danger, it's what it would be with you or I. Elders with dementia can often threaten someone else's life. They can gain access to things that would be weapons in their hands, knives, scissors, those sorts of things. More often, though, it is an elder will wander away, will walk away, and put him or herself in danger. There's a lot of retention ponds. They won't know where they are. They'll get lost. We've lost people who get hit by trains, by cars, those sorts of things.
What are some of the reasons that these behaviors occur?
If we knew that, we'd be able to control them better. But the majority of the reason of the precipitation is that the elder is stressed. There is a level of anxiety or agitation. And if you do not work with that agitation and try to forestall it, you're going to get things like resistance. Popping into someone's room and shouting, "Good morning, let's get up, let's go," might work for your 15-year-old son, but it's not going to work for your 85-year-old mom with dementia. That's going to kick off that agitation and start things right away.
And for the caregivers who are watching, what can they do to either de-escalate these behaviors or help to add to it or prevent them even?
Right. Knowing the person, whether you are a paid caregiver, whether the individual with dementia is in an assisted living facility or some other care facility or home with the daughter, you have to know the person. So you're going to know what they did for their life, for their life in the past that was entertaining or for work. You're going to know their triggers, what upsets them. Loud music versus soft music. Barking dogs that are yapping at their feet versus a kitten to pet. I mean, you have to know that person. That's the key, preventing.
Now, obviously prevention is primary. Everyone would like to be able to prevent this, but what if a caregiver can't? What if they can't direct the patient? What is their next step?
Well, hopefully you would be working with a physician, and you would be letting that physician know that it's getting a little bit harder and harder to get mom to come in, for example, or it's getting harder and harder to keep her from going out. You're going to have things put together, boxes to redirect them where they have only special things to work with, drawing articles to read, things like that. If you absolutely cannot redirect, sometimes your best thing is just to follow, again, as long as they're not a danger to themselves or others. If they become a danger to themselves, then you're probably going to have to call for help, call 911, and ask for a specialized officer to be sent.
Is there a chance that a patient with dementia could be Baker acted? And explain to our folks what Baker Act is so they know that word.
Baker Act in a nutshell means to be involuntarily committed or held for 72 hours for an examination to see where you are emotionally, psychologically. Yes, there is a very good chance of that. And sometimes it really is the only way to protect the person at that moment in time.
Okay, so let's go back now, back to prevention, because obviously that's really what everyone would like to do. Drug interactions, what are some other things people should be kind of just keeping at the back of their mind that could help them?
First thing you want to keep in the back of your mind, if this is a sudden change in behavior, is there a urinary tract infection? That is one of the number one primary causes of erratic and unusual and very difficult behaviors. Okay. Drug interactions are another very important cause, so you want to have the doctors always look at what the mix is that the person is taking. Food interactions sometimes, the environment, is the music too loud? Is there something going on that you're unaware of? Those sorts of things.
Well, this is fantastic information and very interesting. Who would have thought a UTI, urinary tract infection, is something that could stimulate that kind of behavior?
That is what you should look at first. Always, always, always. If mom or dad has always been walking fine and suddenly they fall, check for a urinary tract infection. With a sudden, again, change in mood, behavior, sudden is the key. Look for that.
All right. Well, Edith, how can folks reach you?
I'm at the office. My phone number is 407-843-1910, or you can reach me if you like to email. It's my name, Edith, E-D-I-T-H, at adrcares.org.
All right, Edith, thank you so much for sharing with us about dangerous behaviors in dementia patients, raising awareness. Very, very good information. And hopefully you have been listening to this important information as to what you can do as a caregiver to hopefully prevent these types of behaviors.